But in the household, everything you just pointed out, it's amazing how many things that we share in our lives where we don't realize that there's some blood contact that's enough to transmit the virus. We're not the leaders in the world. The Chinese were by far the first to understand this, made this mandatory in China, and they have seen an entire generation go from very high percentages of individuals infected at birth to now almost non-existent. So, we're not alone in trying to pursue this approach.
Dr. Osterholm, the nights are dark and getting longer. How are you doing?
Well, right now it's a challenging time in public health as it is in many other issues around the world. So all I can say is like the fact that it will soon be changing course and the days of getting longer again. I can only hope from a worldwide public health standpoint that we can see the same changes coming.
I have some questions for you about that. Particularly today, I want to talk about hepatitis B, vaccines and the virus and recommendations up until now and how they might be changing. RFK Jr., Trump's appointee for Surgeon General Casey Means, Senator Rand Paul, and others have argued that it is crazy to vaccinate newborn babies for hepatitis B if their mother had a negative test for hepatitis B during pregnancy. And despite their very influential positions, I'm not sure if they know that we actually tried that in the United States. We tried vaccinating based on test results in the past, and it didn't really work. Can you walk us through what we previously tried, why it didn't work in the United States, and basically how we got to where we are today with a recommendation for universal vaccination of newborns for Hep B?
Well, for almost a 20-year period up through 1991, we tried any number of different approaches to testing people who we suspected having hepatitis B, i.e. pregnant individuals, and then trying to vaccinate those children. And it should be noted to your listeners that the way that we're so concerned about transmission is largely when during the birthing process in particular, a child will be exposed to the virus of the mom, who may or may not know that she were infected. And so there was a gradual evolution of recommendations up through 1991 to try to get more and more women tested, have them followed up, and then have the child appropriately vaccinated. That just failed. We continued to see large numbers of cases occurring in this country. Remember, at this point, about 18% of women today are still not tested for hepatitis B surface antigen, or the test that tells us that they have hepatitis B, as well as the fact that then there's only a limited number of people who actually have follow-up, even after they're tested, without a long-term outcome issue. And so what we really landed on was the way to do this is test all women, yes, but most importantly, vaccinate all kids. And that's where we saw this dramatic drop. And since 1991, we estimate that we've actually prevented over 6 million infections and over 1 million hospitalizations because of this new approach. Now, one could argue that, well, that seems like you're asking people who aren't at risk to do something. But in fact, again, unlike some countries that have a comprehensive healthcare system, these people fall through the cracks, and they have fallen through the cracks. And so now what we're doing is basically taking an approach where we have a very safe and a very effective vaccine. No one has challenged the safety or the effectiveness of these vaccines. And we're now covering those populations that would have been missed in the past. And this has had a huge impact on the public health issues related to hepatitis B.
That makes a lot of sense from a public health standpoint. I want to follow up on sort of the very individual standpoint. Like if you know for sure you are hepatitis B negative as the mother, you took the test very recently, maybe there's a couple % chance for a false negative result. How is the virus transmitted in the real world, aside from needles and intercourse or infection during birth itself?
Well, let's just be clear about the fact that there will likely be some children who will, in fact, not be at increased risk right at birth, and that you could argue, well, therefore they don't need to be vaccinated. The challenge with that is like giving people the option of, do I use my seatbelt today or not? You can decide. Okay, you don't. I mean, how many times have you put your seatbelt on as a mandatory action of a law in your state requiring seatbelts, and you say, well, but I'm just going down 3 blocks to my neighbor's house. I'm not going to be at risk. And in many ways, it's a very similar situation. is the fact that we still don't want to miss those who might be test negative at a given point, but in fact are infected at the time of delivery and transmit the virus to the baby. And if in fact this were a negative impact issue, such as if the seatbelt were going to cause you to have severe back damage by using it, or somehow would cause you to have some health ailment, you could argue, well, maybe mandatory seatbelts should be left up to the individual, not to the state. Well, in many ways, there's a lot of similarities here, where what we're saying basically is because it is so safe, is so effective, that in fact, to make certain that we even pick up those kids that would fall through the cracks, we will enact this approach. And what's really been important, I think, is that it has been very successful. Hospitals around the country now have a very specific stockpile of hepatitis B vaccine in-house. The system has been well worked out, and the vaccine is covered for because it's recommended under the Vaccine for Childhood immunization here in this country. And those are the things I think are really important to emphasize. If this recommendation is rescinded by the ACIP, then there's a real question, will the vaccine programs that we currently have in this country actually cover the cost of these vaccines? And now that's a whole nother issue, because if you add cost to it, that is prohibited for many people who just can't afford a vaccine at that time. So I think when you add this all up, think of your seatbelt example and think to yourself, how many times have I protested that? And how many times is that likely because I didn't protest it saved my life or someone else's life? And this is very similar to that very issue. In other words, if the mother or the baby were at some risk of an increased health impact because of the vaccine,
Right.
then you could argue, well, we got to have that discussion, and we would. But the fact of the matter is the body of data, over 400 studies dating back 40 years, have shown repeatedly there is no evidence of increased risk of any kind of serious health effect, and the vaccine is highly effective.
I do wonder, I love the seatbelt example. I do wonder today, if seatbelts weren't mandatory and we tried to make them mandatory, if that would happen in today's
Oh, I
climate.
think not. I think even the bigger one we see is car seats. And the fact pediatricians, family practitioners, nurse practitioners would tell you, thank God for car seats. And the fact that how many children would be seriously injured in relatively minor accidents if, in fact, they were not buckled in like that. And again, what's the likelihood you're going to have an accident with your baby? Very, very, very low. And, I don't, so it's just too difficult to strap them in. We're just going 3 blocks to grandma's house. And yet that's really important because it's in that 3 blocks that oftentimes they do end up getting sideswiped and having a serious accident. So I think that's the kind of message we want to get across is that there's no downside to this. It's an upside only.
Right. That's that sounds like a familiar quote we've heard recently. To go briefly back to transmission, my understanding is you can be infected too from surfaces, tabletops, washcloths, other fomites, and the virus can remain infectious for days, I think a week or longer. Is it true that a lot of people assume, the risk, and maybe it is true, that the main risk is from if the mother is infected, that the baby becomes infected during delivery? But that also caregivers or the father or other children in the home might be infected and not know about it and potentially leave infectious virus on surfaces. And then if a baby has a scrape, which often happens with babies, I have a toddler, I can tell you, that it could be infected via those routes as well.
Absolutely. And I think that's another important point. The first line of defense is making sure that an infected mom does not transmit an infection to the newborn baby. They may transmit the virus, but if you have immunity, basically you prevent that infection from occurring. And I think that one of the things that people really don't appreciate is once infected, the vast majority of these kids become chronic carriers, which then leads to very serious health outcomes down the road, hepatocellular carcinoma, cirrhosis of the liver, etc. And so at this point, what we're trying to help people understand is that the first line hit is the actual delivery. But in the household, if you have someone who has hepatitis B, everything you just pointed out, from using toothbrushes, it's amazing how many things that we share in our lives where we don't realize that there's some blood contact that's enough to transmit the virus. So again, this whole approach has dramatically reduced the transmission. And ironically, we're not the leaders in the world. The Chinese were by far the first to understand this, made this mandatory in China, and they have seen an entire generation go from very high percentages of individuals infected at birth to now almost non-existent. So, we're not alone in trying to pursue this approach.
There are some other countries in the world, I think Denmark, that don't have a universal newborn hepatitis B shot. I think they instead vaccinate based on either test results or risk factors. I'm not exactly sure. Is that true? If that is true, what is different about hepatitis B or the healthcare systems in those countries versus the United States such that we can't just copy them or vice versa?
Yeah.
Should they also be doing it universally, or are there fundamental differences?
No, actually, and this is an important point because this comes up often and saying, well, why can't we be like Denmark, where in fact they do base it on a risk assessment? But there they have virtually no one falls through the cracks. They have accurate and timely information on the status of the mother for the infection. And again, we keep coming back to this issue because of the number of women that fall through the cracks who are infected, who do transmit to their baby. And that's what happened again up until 1991. We got closer and closer to this routine recommendation for vaccination, but never quite got there. And as a result, we saw this increased number of kids every year in this country. That same approach in a country like Denmark that has an outstanding countrywide healthcare system where they have records on everyone. It's all linked. I mean, in fact, if anything, if you may recall during the COVID experience, where do we get some of our very best data on vaccine effectiveness? Was from countries like that had the kind of infrastructure that could tell you on a drop of a dime what's the status of all these different people are. So, I would love to see us get there, because if we could get to that same kind of healthcare system, think of all the other healthcare problems we'd be dealing with. But we're not there. And so my job is to basically say, so then what can we do to still affect these cases of hepatitis B? And that's what we're trying to do here.
And do you have a sense for how many people total are carrying hepatitis B?
That number varies. I don't have the exact number off the top of my head, but it's surely dropping precipitously as we see a whole generation avoiding it. And that's what's happened with this, eliminating over 6 million infections since 1991. Think of, in fact, all those people had been infected. 91 to 2025, 26 means that by that time, these would be the cases of hepatocellular carcinoma and cirrhosis that we're seeing right now. Those numbers have really dropped because of this kind of activity.
It's effectively kind of a vaccine against liver cancer. I think a lot of vaccines, there's the HPV vaccine, which is effectively a vaccine against cervical cancer and some other types of cancers sometimes. I think it's not often pitched as an anti-cancer vaccine.
It's huge. And in fact, the experience that really brought that home to us was work that the Chinese did back when the vaccine first arrived in the 1980s. And there they had an ongoing major problem. In fact, hepatocellular carcinoma was the number one cancer in the world, surpassing lung cancer. And it was because of this maternal to newborn child transmission occurring. The Chinese put into place a very similar program that we're now using in the United States. They went from having as the number one cause of cancer in China, primary hepatocellular carcinoma from this, to now it's almost non-existent. And that all happened because they saw what they could do with these vaccines. And so you're exactly right. I mean, we've often said this was by far the first demonstrated vaccine to prevent a cancer that we have had ever in history.
Now, I've got one for you that seems crazy. I hope you can explain. For the newborn hepatitis B shot, in the package insert that comes with the vaccine vial, if you look at section 6.1, it describes safety data from a clinical study. It says had 147 infants and children who were monitored for 5 days of follow-up. And people share screenshots of that all the time on social media. And that does seem absurd at face value. Can you speak to how many children actually have been studied for safety, over what time frame, with what safety monitoring systems, and why is that information not reflected in the package insert for the actual vaccine?
Well, remember, first of all, those are the data that were supplied to get the vaccine approved. And we can all argue that, what kind of data do you need or not need to get approval? So I'm with you on that. I actually agree that doesn't tell it. I'm very happy to report that today on our website is that comprehensive review that the Vaccine Integrity Project, part of our center, did, which includes over 400 studies over 40 years, for which the data are comprehensive, exhaustive, and convincing that, in fact, the vaccines are effective and safe. So what I would do is every time somebody has a screenshot of that package insert, which I'm glad you actually illustrated that because I think it is a reason why people could be confused, and send them to the link on our website for this report, which will go through. And we detail every one of these studies that looked at the very point that you raised. And I think we did not, as a public health community, necessarily do a great job of sharing with the public, one, the extent that the problem existed. Number two, what were the remedies for that? How safe were they? How much will it cost me? What does it mean to my relationship with my baby? And I think that once that kind of information becomes readily available, it becomes kind of, well, we use, as you know, we use antibiotic ointment in the eyes of newborns to prevent a certain bacterial infection from becoming prevalent and a big issue. Parents would never think, in most cases, to ever say, "Well, I'm not going to let you do that." Again, it's something that surely provides real benefit to the child. And so I think that's where we're at here today. And again, I refer them to our center's website. If you can post a link to it, that paper should help give them the information that they need and want. By the way, that wasn't an out of bounds question. That was a great question. You suggested to me that that might be a challenging one. I think it's a great question and it's an important one. It is a very important one.
Yeah. And I think it's important to be realistic about this. Like, even if you are a strong proponent of vaccines in general, seeing something that says there were 140 children as supporting the safety justification for universal vaccination of children doesn't really make a lot of sense today, unless you consider the decades of data we've seen since then. I kind of wish that package inserts would be updated to reflect the breadth and duration of evidence that's been collected in the interim, because it's not easy to find that information. And what's being selectively served to you over social media is, of course, what is most emotionally engaging, not necessarily what is
And
most
let me just
scientifically
say,
accurate.
I think what you're raising is really a very important point that has really an issue with a number of different medical approved products, drugs, or vaccines. And today, there's no reason you can't keep an updated overall library of information that is well beyond that. So yes, you can't give out a 400-page booklet every time you have a product, but you can basically allow someone to go to a website, which didn't exist. Remember when the vaccines first came out, this didn't exist, this technology. I think what you raised is a really good point, and that's the whole purpose of why we did the review we did, because that should be available. And why not put a QR code on the package insert of 1 or 2 pages and let the public go back to the full breadth of the data and let it keep building. I think as new things happen or issues come up, that should be part of that library of information about those. And so I'm glad you raise it. I think it's an important point.
What about if you are not sure what to believe because maybe the CDC, maybe the Secretary of Health and Human Services are saying things that differ from your own pediatrician or the AAP? What if you want to just delay by, say, a month or a couple months or something instead of getting it at birth? What do you know about how that changes either the side effect profile or, I guess more importantly, the efficacy profile of the vaccine from some type of slight delay?
Remember, exposure for most of these children occurs at the birthing process. The same thing is true with HIV. And so if you can be timely in your interface at that moment when they're exposed with the vaccine, that has a tremendous benefit as opposed to a month later, when by that time, the actual virus from mom will now start growing in your liver as a young child. And so the earlier you can, and in addition, one other product that we do use when we know that a mother is definitely positive is called HBIG. It's basically an antibody preparation that helps block the virus that you've been exposed to. And so it's a combination of those two in that first month. But we do see then substantial reduction after that time in how protective these vaccines are. So timing is important. Um, And, you'd like to say, well, if I get a vaccine in the first year, that's way too late. Okay. That's like putting your seatbelt on after the bus has already hit you. It doesn't work well that way.
But it does work at birth, even if the
Yeah.
transmission could be happening at birth, because the virus takes long enough to actually establish infection that the vaccine has time to give you protection, unlike many vaccines, unlike the flu vaccine, for example.
Yeah. It's interesting because one of the vaccines that I have always been fascinated by and have done a lot of study on is smallpox vaccine. And the late Dr. D.A. Henderson, as part of the WHO program, demonstrated that you could actually vaccinate someone who had been exposed to smallpox, which has about a 2-week incubation period, within 3 to 5 days and prevent the infection. So even though it's 3 or 5 days after your exposure, the vaccine can help jumpstart that immune system so you do not get an infection and clinically ill. And so we do have those experiences like that. But not all vaccines are the same. Some, if you don't cover it right now, you're not going to cover it. And when you have a disease such as COVID, for example, where you're talking about an incubation period, time from exposure till you get clinically ill, of 48 to 72 hours, vaccines are not going to have time to work there. So this is one where we have the benefit of it working. And that to me is a real gift to all these infected moms and their subsequent the transmission or not transmitting to their babies.
RFK Jr. and others have previously hinted, sometimes not so much of a hint, sometimes rather overtly, at a link between hepatitis B vaccination, the newborn dose, and autism spectrum disorder or other medical conditions like autoimmune disease, allergies. In your group's review of the published safety data, what were your findings on autism or other diagnoses, I guess under an umbrella that may take longer to show up, the things that don't happen immediately?
I can say with absolute certainty there was zero signal of any of these issues. Well, a low-grade fever, some redness at the site of injection, these are the most severe things we've seen. Otherwise, this has been a remarkably, remarkably safe vaccine. And, we now have had enough time to follow it so that we're not talking about 6 months or 12 months, but we're talking about the effectiveness of the vaccine into 30 and 40 years. And we're talking about the side effects. And so, we can even say with confidence, there's not a late sequelae kind of picture that might occur 20 or 30 years later. So again, that's what makes this argument for vaccinating at birth so compelling, is that you're doing no harm and you're doing a great deal of good for your child. And that's what we need parents to understand. And let me just come back again to one last point, is if the uh, ACIP this week votes to rescind this recommendation, the Vaccine for Children's program and so forth are not going to basically kick in. Then we've guaranteed a number of these mothers that they will transmit to their child because they won't be in a position of saying, yeah, okay, I'll pay for that vaccine.
Right. Effectively, and I don't know whose head this falls on at that point, giving some children statistically, liver cancer, cirrhosis, death from those conditions.
Anyone who's had liver cirrhosis will tell you that it is a horrible, horrible disease. And, a liver transplant today is $320,000. That's the kind of thing we're talking about if you have any hope of basically turning the course. Primary hepatocellular carcinoma, liver cancer, is one of the hardest, most difficult cancers to deal with and treat. And so, again, from that perspective, this is not a stitch in time saves 9. This is a stitch in time saves 1,000,000.
Now, this just occurred to me. I should have asked you much sooner, maybe at the very beginning. Your safety review, efficacy review, you've said it's independent. What evidence can you present to me that you or other people on the team doing this work don't have any connection to the pharma companies that sell the hepatitis B vaccines? Can you give me insight into, have you ever in the past or now received any money for any of this, anything related to this?
Thank you for that question. Actually, I welcome that question. I have never received, nor has our center received, a penny of money from pharmaceutical company, okay, in any way, shape, or form. All of the support for the program we did comes from philanthropic support. in this case from Alumbra, Christy Walton's private foundation. We all did disclosures of any kind of potential conflict of interest that were reviewed by a neutral third party. We had none. And so I think this transparency is absolutely critical. And I welcome when I get questions about that. I started my career, by the way, back in the mid 1970s here at the Minnesota Department of Health. And I was one of the two people that first indexed Guillain-Barré syndrome cases associated with the swine flu vaccine and was obviously not very popular for a while. And then finally it became evident that this was really truly a problem. In the mid 1980s, our group was the one that basically said, hey, wait a minute, we have overstated substantially the benefit that influenza vaccines provide. It's not 70 to 90% protection. So, we have had a long history of just telling the truth. All we see ourselves are as balls and strikes counters. That's it. We're not here politically. I've served a role in every presidential administration dating back to Ronald Reagan when I was involved with the HIV/AIDS Commission. In Trump 1, I was a science envoy at the State Department trying to help spread the message around the world in 2017, get ready for a pandemic. I'm not sure that went very well. But the point being is that we've always just been, calling balls and strikes, and that's what we did here. And we did that with our previous review that we did on COVID, RSV, and influenza vaccines, which we published in the New England Journal of Medicine several months ago. And we'll continue to operate that way. We're non-denominational in every way possible.
Well, thank you for your work and your team's work, and thank you for your time today.
Thank you.